Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist. And in this video, I'm going to share with you exactly how you can measure and track your way to pain relief if you're dealing with some type of back, butt, or sciatica problem. I'm actually going to do this by sharing a live workshop that I held virtually the other day for back, butt, and sciatica pain sufferers worldwide who are looking to take a more scientific approach to pain relief rather than just trying a bunch of random things and then hoping that it works. I actually will show you in this video what you need to track week to week as it relates to the movements in your body, as it relates to the activities that you're having trouble with. I'll actually walk you through how to create your own pain tracking system so that week to week you know if what you're doing is working, not working, or a waste of time, or even maybe keeping you from healing. So stick around for this workshop. And the entire process I'm about to teach you is based off a quote that I think just makes sense. And it goes like this: you can't manage what you don't measure, right? You can't manage your finances if you don't have maybe a budgeting app, right? How would you set cabinets, right, without a level? Or build a house, without one of these puppies, a tape measure, right? How would you bake a cake, right, without a measuring cup? And when it comes to health, right, how would you measure your blood pressure if you didn't have a blood pressure cup, a stethoscope? How would you measure blood sugar if you didn't have something to check your blood glucose, right? And so everything else in this world, we tend to have some tracking system, a scale to get on if we're trying to lose weight. But when it comes to pain relief, most of us just wing it. And most of our providers don't actually measure things that are meaningful to us in our lives. And often they don't track anything at all. And so if you're going to PT right now and you feel like I'm trying all this stuff and I'm not really sure if it's working, we want to know that it's working. So stick around for this workshop so that you can come up with a plan to measure so you can manage your way to pain relief. Oh, and by the way, if you're interested in determining the most likely source of your back, butt, or sciatica problems for free, click the link above to download my Better Than an MRI DIY diagnostic guide. All right, let's dive into it. All right, so here we go. We have a case this year. She is a middle-aged female, all right? And just to kind of help you understand the background, the type of people we work with, and then how we synthesize this and made this super simple to track. January 2023, so you figure she submitted this. We worked with her earlier this year. You can see the date up top. This is timestamped. So at 3:27 in the afternoon on the 25th of March of this year, she submitted this, about 6, 7 months ago. And she had been dealing with pain for over a year, right? So 15 months, January 2023, back, glute, nerve irritation. Then it kept going into the glute, the back got a little bit better, but then had some SI joint stuff. You can see her pain kind of ranged, right? So it actually started to increase over time. She wasn't sure if episodes were combined, but as far as what originally caused her pain, it was a 17-hour-long flight combined with a workout that maybe started it as she had taken a break from exercising and then started to get back into it. All right. Going through this, I'm not really sure what caused it, but again, working out, things like that. She had multiple X-rays and MRI. She actually has a background in the radiology sort of a section of healthcare. All right, so was diagnosed with spondylosis with radiculopathy, basically like what most people would term like a pinched nerve. Recommended PT, oral steroids, and over-the-counter anti-inflammatory drugs, and then follow up in 6 weeks to get an MRI to evaluate for stenosis, the L5S1 level. She saw her general practitioner. He said it's a muscle issue. Gave her Flexerol muscle relaxant, referred to Chiro. Went to Chiro, all right? Chiro said locked SI joint. They can't agree, right? They said, hey, they're not working together. So there's many opinions. Surprise, if you're watching this, how often does that happen to you? How often does it happen that you go to see the Chiro and they say one thing, the PT they say the next? Obviously, they're not communicating with each other, right? And so you're getting mixed signals, right? Good days and bad days, but now it's getting worse over time. She was getting really frustrated, always in the same spot, but it's changed. She's been getting Chiro, and it's actually been making it a little bit worse. She can't sit. She can't tie her left shoe. She can't put her left sock on. She can't straighten her left leg while sitting. Bending at the waist, bending forward is really yucky. In the early phase, elliptical, CBD cream, ice, things like that made it better, but again, it's getting worse. She has lots of different yucky motions. Twisting to the left, putting her socks on the left, pulling your left knee to the chest, raising her leg up, bending forward, bending backwards, all right? She has no strength loss, so we feel confident that there is not actually damage to the nerve, all right? Because the muscle or the nerve, the feeling signals and the sort of motor or strength signals are working because we actually have you go through a strength test and identify what motions feel good, etc., versus not, yummy, yucky, within this case review. All right, previous history: cancer, skin cancer, car accident, trying lots of different things. Pain's constantly on her mind. And she said, look, I'm at a pivotal point in my care where I need to decide what's next in my journey. I'm not progressing with chiropractic adjustments, and I'm going to have 2 class 4 laser sessions this week, as the chiropractor thinks there may be scar tissue. So chiropractor said it was SI joint, it was locked. Now he's saying it's scar tissue. The general practitioner thinks it's muscular. The radiologist thinks it's a pinched nerve. I have a local PT consult, it was scheduled, but she basically came to me. She said, Charlie, I want to work with a specialist. I could go there, but I don't feel confident that they're going to help me. In fact, I actually think that they might make me worse. I'm not sure they know what they're doing. Saw my content and then reached out to me. All right. And so this is her background. Now, the reason I share this, you're like, what does this have to do with measuring my pain? There's a lot going on here, right? A couple pages of information. So it's like, how do we simplify this? How do we measure this pain that, it has good days, bad days, and now it's constant. It hurts here, it hurts there. They say it's this, they say it's that, right? It could be confusing to lots of people, but it's actually not so, all right? So let's boil it down for you. So I'm going to actually share another screen. Let's see. All right, so what are we looking at here? All right, so keep your eyeballs wide open. All right, this is actually what we would supply you with within 24 hours of enrolling in the process and program that we've created. People get access to a private healing log that we create for them. All right, so you've got this weekly tracker tab. This is what we're really going to focus on today, but you've also got other things like an evidence list, which helps you determine how much of this is due to body, how much of this is maybe due to brain, a sensitive central nervous system, and what do we think within the body is actually causing the problem. We have ways to actually go through, have you answer some basic questions and kind of spits out a response for you. Pretty cool. All right. Hunting log. How do we know what motions we need to do and the process to test things to find the 1 or 2 motions that's going to work best for you versus just a sheet of exercises. We help you identify a pain pattern, right? So you can get in the ballpark of which motions are going to be best, etc. So we lay it all out for you. All right. Now, this weekly tracker. So if you are at home right now, what I would ask that you would do, all right, is that you would write or have a little section on the piece of paper, right, or at least in your brain or on a notepad or on a sticky tab somewhere, and have a section for your top 3 yucky emotions, right? And then have a section for your top 3 pain triggers. Right? Yucky emotions are things that reproduce your specific problem. Now, here's the cool thing. It doesn't matter if it's a spondylosis or arthritis. It doesn't matter if it's a spondylolisthesis, a slippage. It doesn't matter if it's your SI joint, your piriformis, your pudendal nerve, your pelvic floor, your hip, your bursa, your tendon, your sciatic nerve, L4, L5, S. It doesn't matter because if there's a problem with the body, you're going to be able to move your body in some way that reproduces your symptoms. All right. And we're going to be able to pick that up in a movement exam. And so then the way that that diagnosis shows up for you is in the yucky motions that it creates. It manifests as yucky motions, trouble moving, and it manifests as you having difficulty living life. Triggers are activities in life, right, that are really bothersome for you. All right. So just kind of like have a little blank space for 3 yucky emotions, all right, and then 3 pain triggers. Right? You can see here, activity, sitting, driving, walking, etc. Now, there's a bunch of numbers here. Oh my gosh, what are these numbers? All right, it's actually pretty straightforward. All right, and so first thing I want you to understand is that I'm going to have you actually go through some motions right now. I just zoomed in. All right, so I just zoomed in. And we're going to go through a total body scan really briefly. All right. I think this is useful. It'll take, I don't know, 5-8 minutes or something like that, maybe even a little bit less. But a self-assessment. You can't mess this up. And the intent of this is, by the way, not to make you worse. All right. So if you go through this, you might notice some symptoms. But if you're watching this right now and you feel so darn sensitive, you're like, I can't move my body in any stinking way, Charlie, because every motion is going to be yucky, then that's fine. All right, we can ixnay this, and it's not a big deal. It's not a barrier to collecting accurate data or anything like that. It doesn't mean we can't help you. We can help you. It just means we probably need to focus on something else first. All right. So what you're seeing here, all right. So again, I'll zoom out. You see the entire tracker, right? So you can see your yucky motions, the pain triggers. You can see, right, week to week that she is getting better, and eventually she's done. She's all better. There's no question about what's working week to week. There's no question about if she's improving or if she's stuck or if something's getting worse. All right. We're not guessing, we're testing, we're very systematic. This is our scale. You need to have a scale. This is our tape measure. This is our level to see if what we're doing is headed in the direction we want or not. And by the way, same, better, worse is okay because you can learn from any of those things, but then you make decisions based off those trends, not what you think or you feel. This is a change for a lot of you, right? Because my guess right now and you can put this in the chat, is like, how many of you are tracking your progress objectively with data? How many of you have physical therapists who have shown you, right, hey, here's where we're going to come back to look at these numbers to see if they improve, and here's why it matters for you. Because here's what I'll see physical therapists, chiropractors, and other people do a lot of times, right? They will say, oh, well, your knee bends to 90 degrees. And we want to see it get better than that, right? And so then, you have back butt sciatica pain, and so they're measuring how well your flexibility is or something like that, and they say, oh, look, your knee now bends to 100 degrees. Your knee now bends to 110 degrees. That's great. And you're like, yeah, but I still can't sit or drive. So it's great that you're measuring my knee motion, but how is that meaningful to me? Because it's not improving my overall quality of life, my function. These are the things, Charlie, I care about. All right. I don't know if I care so much about these. All right. That being said, we've got to measure something. All right. We've got to have a process. This is the way that we track things. All right. So top 3 yucky emotions, top 3 pain triggers. How do we get the top 3 yucky emotions? We've got to identify what they are. All right. So here's what we're going to do. First things first, I'm going to walk you through 12, 13 motions. All right. And we're going to see, all right, what happens for same or number one, are they yummy? Meaning if the motion is not a problem, it's yummy. You don't have to put anything next to it. If the motion is yucky, now let's define a yucky motion. A yucky motion is any motion that reproduces your pain or problem. All right. Your familiar pain or problem. If you have leg pain, ooh, there's my leg pain. If you have a pain in the butt, ooh, there's my butt pain. If you have a pain in the groin, ooh, there's my groin pain. Those things would classify as, ooh, if I did that and it reproduced that yucky thing, then that's a yucky motion. And then how yucky is the motion? So let me zoom in. All right. So as we go through each of these motions, we'll just do 1 or 2 reps. If it's yummy, it's nothing. All right. But if it's yucky, then you want to ask yourself, is it low, medium, or high yucky? Is it low, medium, or high yucky? And by the way, you can always come back to this conversation, even if you don't want to do it now, just get a gist of the concept. If it's low, the higher the number, the worse it is. 10, 20, 30. If it's medium, it's a 40, 50, or 60. We call it kind of like yellow zone. And if it's red, 70, 80, 90. Right? Any answer is okay. Right? You can see here that this woman started with really yuckies. 90, 90, back bend. Couldn't really function, couldn't really move. All right, so let's do this together. All right, so we're going to go through this body scan. Find a seat to start, comfortable seat if you can. Right? And we're going to do 1 or 2 reps of each of these motions. I'll walk through them with you. And then I'm going to ask you, is it yummy or yucky? If it's yummy, great. If it's yucky, I'm going to say, is it low, medium, or high? And give it some number. Cool? All right, let's do it. Let's take a few minutes to do this, and then let's cruise through the rest of it. All right, so here I am. Hopefully y'all can see me, all right? Trunk twist to the right. Trunk twist to the right. Right? So you're going to twist the trunk to the right just 1 or 2 times. Twist the trunk to the right 1 or 2 times. And when you turn the trunk to the right, does it increase your yuckiness? Does it reproduce your pain, numbness, tingling, problems, wherever it may be happening? If no, it's yummy. There's no score to it. There's no problem. If yes, it does, then that's a yucky motion. And then I'm going to say, is it low? 10, 20, 30. Is it medium? 40, 50, or 60? Give it a number. Or is it high? 70, 80, or 90? Low, medium, or high? 10, 20, 30, 40, 50, 60, 70, 80, 90. Okay, so that's the right trunk twist. Now let's go to the left trunk twist. Next motion. And notice, look at me. I don't care if you put your leg down when you do it. I don't care if you put your hands here. I don't care if you put your hands here. It doesn't matter. You put it here. You twist to the left. Yummy? If so, no number associated with it. Yucky? If so, low, 10, 20, 30. Medium, 40, 50, 60. High, 70, 80, 90. All right, so there we go. We got trunk twist right, trunk twist left. Now let's go knee to chest right. So you can sit back in your chair, by the way, if you want. You can pull your knee all the way up. How's that feel? Yummy or yucky? If yucky, score it. Low, medium, high. There's a little scale, okay? I'll come back to it and probably zoom in and off. I don't want to get too crazy with the changing of screens, but I want to make sure you can see me and the scoring system. Now the left leg, pull it all the way up. How does that feel? If yummy, leave it. If yucky, give it a score. Now figure 4 right. Figure 4 right and figure 4 left. Figure 4 right is as if you're putting your right ankle up on your left knee, almost like you're going to tie your shoes. Remember Dawn said she couldn't do this on her left side because she couldn't get to the bottom of her socks and shoes and stuff like that, right? So what does that feel like? You can just kind of pull it up and just see how that feels. Is it yummy or is it yucky? Yummy or yucky? If yucky, low, medium, high, give it some number, some score, okay? Remember, you can absolutely do this along with me, okay? Now we're going to go to the other side, left. So what happens there? When you do the left, maybe you're trying to pull it up. You're doing one of these things. All right. Yummy or yucky. Low, medium, high if it's yucky. Give it a score. You can see here, if that was super yucky, that was a 90. All right. It was in this red zone, as high as it could go almost. So we did the twist right and left, knee to chest, figure 4. Now leg raise. So leg raise. There's your scoring system. All right. Leg raise right. Just kind of lean back in the chair. Can you do this? Raise it up. What happens? That's the right side. Right leg raise. Yummy or yucky, low, medium, or high. Let's go to the other side. What's that like? I'll tell you right now, if you have sciatica, pain, numbness, or tingling, that's going to be a no-no. All right, it's a yucky motion. It stretches the nerve in the back of the leg, tensions it, and if that nerve is sensitive in any way, shape, or form, due to whatever, stenosis, disc, piriformis issue, whatever, that will be restricted and painful. All right, leg raises. Leg raise left was yucky, but her right one was yummy. Cool. Now, forward bends. All right, we're going to go 3 directions forward, 3 directions backwards, and we're done. Forward bend, just like this, center. Or you can put your hands here if you want and go all the way down, or you can put your hands here. You're just going to bend down. And then on the way up, you can put your hands here and push yourself up in case that's easier. All right, we're going to go down. And you're going to see how that feels. That's forward bend center, right in the center line of the body, right? Center line of the body. Is it yummy or yucky? And if so, is it low? Is it medium? Or is it high? Low is 10, 20, 30. Medium is 40, 50, or 60. And high is 70, 80, 90. Okay, so that's the center forward bend. Now we're going to go to the right. So I'm going to put my right hand on my right knee, and I'm going to go over top. So like my chest, center of my chest is basically hitting the hands on my knees. And then we do that once or twice. We're going to say, okay, was that yummy or yucky? Low, medium, high, and give it a score. So we did center forward bend, center. Forward bend to the right, kind of checking the corners of the body to see what this motion is like. Now we're going to go over to the left. How does that feel? Yummy or yucky? If it reproduces your familiar pain, numbness, tingling, tension, ache, whatever it may be, whatever the sensation might be described as, give it a number. Okay, so now we did our forward bends. Now, the opposite of forward is backward. So let's go ahead and let's test that. All right, so what we're going to do is we're going to go forward bend or back bend straight back. So feet about shoulder width apart. You're just going to bend straight backwards. All right, so I'm showing you a front view. Just going to bend straight backwards. I tend to put my hands on my hips. You don't have to fall over with this. All right. If you feel more comfortable, you can always put your hands on a cabinet later or something like that, a countertop, and just bend back for some support. All right. But straight back. All right. And we want to see what happens with that. Is it yummy or yucky? Low, medium, high? Give it a number. Now we're going to go back bend to the right and back bend to the left. This is a lot of times a motion that reproduces some stuff. So be careful here, okay? So we're going to twist to the right and then bend straight back. Ugh. All right. Twist to the right and then bend straight back. So I'll turn now. So I'll twist completely to the right and then bend straight back. All right. Again, you just do 1, maybe 2 reps of this, but it should be clear. You don't have to test this a million times. And obviously, I'm not asking you to force through anything that's too yucky. Remember, I gave the disclaimer in the beginning. Goal is not to flare you up here. It's just to identify, ooh, that's a little bit yucky, and then get away from it. So that's a back bend to the right. That was a back bend to the right. And now we're going to do a back bend to the left. So we're going to twist to the left, and we're going to bend straight back. Right. Twist left and bend straight back. Okay, so that is a back bend left. BBL, you could label it as if you want. Back bend left. And again, if yummy, no problem. Great. If yucky and reproduce some pain problems, a lot of times people get stabbing pain in the butt or down the leg, right? Low, medium, or high. How yucky was it? Give it a score. And by the way, just give it a score. There is no pass or fail here. It's just, hey, if it's between a 50 or 60, yeah, it could be that just 60. Great. All right. So just pick one. Don't spend too much time here. And you can see we went through all these motions with her. She had a yummy back bend right, yummy, or a pretty yucky back bend left, and she just went one by one through each of these motions. Okay. So now that being said, is this concept of going through these motions using this yummy, yucky scale, we'll call it. Yummy, doesn't reproduce anything. It's fine. No pain, no problems. Low, medium, high, yucky motion that reproduces your symptoms. If low, 10, 20, 30. If medium, 40, 50, 60. If high, 70, 80, 90. It's okay, by the way. About 50% of the people we work with, Irene, have no yucky motions. How can you help them? That's fine. It's just you're collecting data. The data is not good nor bad. Don't try to judge if you can be helped, what's going on, trying to figure things out. We're not at that point yet. All right. That comes later when we go to the evidence list, when we would dive into different sort of layers of the discovery process. But this is just data collection. It's not good nor bad nor nothing. In fact, it doesn't really mean a whole lot. It's just what we're using to track. All right. Just like when you step on the scale, if it says 220 pounds, well, maybe that is good. Maybe it's not good. It really doesn't mean anything. It's just a story that you tell yourself about it. And the good news is if you can manage it, or if you can measure it, you can manage it and you can change it. All right. So this is just your starting point. Right. If you have all yummies, well, guess what? You're not going to have any top 3 yucky motions. That is the total body scan. All right. That is sort of the base of. Now we go back and we look at the bigger picture and we say, okay, so I went through all those motions. Now what I want everybody watching to do, all right, is if you wrote these down, awesome. If you didn't, you'll probably have to watch the replay, but it's useful to record these because we're making decisions based off the data. Now, what are your top 3 yucky motions? Just pick them. She looked and she said, what are the highest scores? Well, this one and this one and this one. Great. And notice she just brought those up there. And the reason we do this is, as you can imagine, it would be difficult to like track every single motion every single week and then put all that together. It's just too much data. So now we want to synthesize the data, analyze the data in a way that simplifies things and just makes sense. It keeps it pretty easy. All right. Now, if you have, 390s, 770s, and you're like, well, should I pick this motion or that motion? And they're all 70s. What do? Just pick. Doesn't matter. Don't hurt yourself. All right. So just pick your top 3 yuckies, right? Whatever they may be, and write them down. Top 3 yuckies and write them down. People think that healing is a bunch of guesswork. It's like there's so many options out there and I don't really know what to do. And how do I know if this is working? And I think it's working. I'm just going to give it a few weeks to see what happens. It's like this is math. If you can add, even if you can't add, if you have a phone that can add, all right, you can pull up a calculator, you can come up with some different scores, right, which allow you to have some data to go off of, all right? Now, your top 3 pain triggers, all right? So we've done those yucky motions. We pulled the top 3 yucky motions by simply just selecting the worst or the highest numbers there, and we put them right there. Cool. Now, your top 3 pain triggers. What are your top 3 pain triggers? If you're watching this right now, sitting and driving is a very common one that we help folks with, but so are many others. So walking, standing, gardening, lifting, sleeping is a very common one we help people with. Running, pickleballing, that's what you want to call it. Jumping, swimming, hunting. One guy wrote hunting. Surfing, one guy wrote surfing. I mean, look, the possibilities are endless. Whatever you want to put here, whatever activity is problematic for you, washing the dishes, any of that could be here. Then give it a score. And this is a general score, because I realize some days sitting might be better than others, but just in general. If you had to say how yucky is sitting in this example, right? Is it low, medium, or high? Oh, it's pretty crummy. All right, sounds like it's either, a 60 or 70, right? Driving, oh, it's terrible. It's a 70, 80, or 90. Walking, it's like, it's maybe not too bad. Okay, it's probably a 30, 40. And look, it is. Okay, so again, take just your split second, just boom, what is it? Put a number down, right? And then we can move on. All right, they're your top 3 pain triggers. Activities that increase, that you want to get back to that increase your symptoms, whatever they may be. And again, doesn't matter if it's a disc problem, it's a SI joint problem, it's a piriformis problem, it's a this problem, whatever. You can have many things that cause pain sitting or driving or walking, whatever. Maybe it's going to the gym. That's a very common one too. Lifting weights, all that stuff. All right. So you've got your top 3 yucky emotions now. You should. And she was like, hey, I just added all these up and it made it really simple for me. Great. So now what I'm going to ask you to do, and I love what she created here. You guys are always teaching me stuff too, which is really neat. Is she just went 90 plus 90 plus 60, right? And she just came up with a score of 240. All right, so then she had a total score of 240 here, or you could add up all of them. Here's the thing, I don't really care, right? What you could do is you could say 90 plus 90 plus 60 is 240, plus 80, plus 60, plus 40. And what does that come out to? 80 plus 60 plus 40, plus 20 plus 240. Yeah, so 420. So she just did it off her yucky emotions. It doesn't really matter, okay? Now, again, she actually came up with this column, and this is something I've looked to implement. But it might make more sense for you to just add up all the scores and put the total score, all right, in this box. Or on a napkin. Remember, you're probably not having this on a little spreadsheet like we have. By the way, these spreadsheets, I review. I can see this. You just make a little change here. If I write something to her, she can see it. If I wrote hello, right, she can see, wow, Charlie wrote hello at 12:39 p.m. on Wednesday. So these are actually live docs that you have, right? We create for you, and outline everything you need. And then myself, my team, we review these to make sure you're on the right track. And during calls with us and you chatting with me directly, I can pull this up and say, hey, looks like you're on track. Or, oh, what about this? Or what about that? Right. So just know that we keep in communication like that and all on the same page. Okay. So 420, right? Or in her case, she just did these 3. It's fine, 240. Point is that she's taking the initiative to measure things. And that's really the concept we want to help you understand. If you have a better way of measuring it, amazing. Let me know, by the way, because I definitely don't know everything. This is just the system that I've come up with. All right. But that's the idea. You can't manage what you don't measure. And now the cool thing, right, is that every week, all right, every single week on Tuesday, doesn't be at the exact same time, or in this case, if you're doing it now, next Wednesday, you come back to this puppy, all right, that your page, your sheet, or your sticky note, or whatever you put on the fridge, all right, and you do the figure 4 one time, just one rep of the figure 4. Okay, is it yummy or yucky? And give it a score. You do the leg raise one time, just one time. Give it a score. You do the back bend left. Okay, one time, that's it. And then you get an idea of if things are improving. Now for her, this is actually better. All right, I don't know why she put same, but that's okay. But her score went down. We take the guesswork out of this and we make it very mathematical. She went down. She went in the right direction. My guess, if you're watching this, you want these yucky emotions to become less yucky. You want your sitting to go from an 80 to a 70 if, according to the scale, right, the lower the number, the better it is. And so that's what she did. And then, so you're only retesting once a week. Can you imagine how stressed out you would be if you're trying to lose weight and you stepped on the scale 6 times a day? Oh, it's lunch, I didn't gain weight. Oh, it's dinner, I ate too much, I gained weight. Oh, I lost weight. It's not what we're doing. We're not poking the anger bear psychologically and physically by testing these yucky emotions constantly. All right. And by literally taking your thumb and being like, is it there still? Oh, do I notice it? Do I not notice it? No. We want to look at trends. All right. We collect the data and we look at trends week to week. So, better. And she looks at next week. Better. She looks at next week. Better. Look at this. Better. All done. 0. She's pain-free. Really cool. All right. This is after what? January 2023. She started working with us in March, basically April 2024. So a year and 4 months of pain, right? Significantly better, starting pretty much right off the bat, almost 50% better by 4-ish weeks, right in between here, and then fully better by week, 8, 9, something like that. Okay. So that being said, Really cool stuff. So that is how you measure and track the progress. All right. If you have any questions, we'll answer them at the end. So you can put them in there now. Hopefully this is helpful so far. But the thing that I promised you as well is that I would kind of let you in on the tipping point. Like, okay, Charlie, um, how do I know when I can start getting back to things? And what does that look like? Right. So I'm going to share that here briefly in a moment. But the other thing I want to let you know too is this: if your trend is better, I want to be very, very clear about this. Came to me after week 3 and said, Charlie, I'm doing better. What's next? And guess what I told her? Guess what I told her? Put in the chat what you think I told her. She came to me in week 3 and she said, Charlie, I'm getting better. 240 to 160. Her yucky motions are getting much better, which means, by the way, she's living life with less symptoms. Not perfect, but she's moving that direction. What did I tell her to do at end of week 3 when she asked me what she should do next? Yes, very good. Same thing. Cool. Okay. Becky says, stay the course. Dana says, same thing. Karen says, keep going steady. Sherry says, it would depend on how you're feeling, right? Remember, we're not going off what we think or feel, Sherry, although I do care about how you think or feel, right? Like as a person, I care about you as a person, but we're looking at the data, right? Because when we're in pain, we tend to go a bit insane. All right. It's nothing against you. It's just human, the way we're wired. All right. Human psychology. And so rather than trying all these different things, like, I think I'm better. And well, like walking's actually a little bit worse. Well, walking might be a little bit worse, but driving's much better. And your leg raise is better. And so we zoom out and we look at the big picture. We don't want to get caught up on one, oh, I had a bad night's sleep. Maybe this isn't working. I think I'm going to call and cancel my appointment. No. That's one day. We don't want to make macro decisions about whether we change course or not based off of micro data points. All right. So this is why we use the data to stay grounded. And when you look back and you're like, I don't think this is working. What do you mean it's not working, Dawn? You started here and now you're here. Okay. Stay the course. Right. So I told her, she said, what's next? I said, would you rather do more, right? And have and risk bumping your trend from getting better, changing something, and then becoming worse or stalling yourself? Or is it possible that being bored is better, right? Is it possible that doing more causes more confusion and that staying the same course is all you need to do? Why do something? If you knew that a medication you were taking was making your disease better and better, whatever disease you have, right? Your headache, your whatever, right? Better and better and better every single week. Would you call up the physician and say, hey, I think it's working. What medication can I take next? You wouldn't. You would stay the course. And so remember, movement and the mind as medicine. All right. So we're tracking the data, and then we can come back to this and identify what's working, what's not working, and if we need to change. If the trend is better and you're in the green, you're headed towards the destination, you're surely not going to tell the GPS that you're not going to take a detour. You're going to keep going. All right. Good stuff. I just want to be clear about that. All right. So now I'm going to jump over here. All right. Okay. So I took a snapshot of this to carry it over for you. All right. So remember, all right, I said, week 3, she was doing pretty darn good, but week 4, now what's half of 240? Look, I was terrible at math, so the fact that I came back to some basic math, all right, it's kind of funny, but so half of 240, I believe, is like 120. So somewhere between week 4 and week 5, she hit this kind of halfway point where she was about 50% better, right? And this isn't like, some people say to me, well, Charlie, what if your program doesn't work, right? We're just looking at the data. So just, is it working or is it not working, right? This isn't like what I think or I feel or what you think or you feel. What if I think it's not working and I don't want to keep going? Well, you're not thinking it's working. You're knowing it's working or it's not working, all right? So she's about 120 is half of 240. All right. Hopefully that makes sense. And so right around this week 4, week 5, we had a discussion. We said, hey, you're about 50% there. You know what that tells me? It tells me that you're about ready to do what we call cross the chasm, start getting back to life. So at this point, right, I'm just actually going to jump down here. There comes a point in time where when you're in a high degree of pain, remember, she was like in the 90s to start the process, really yucky. She was in that red zone as far as yuckiness for sitting and driving and walking and figure 4, leg raise, all that stuff. We've got to teach you to optimize the healing environment mentally and physically and shift those pain triggers. So we talked to her about how can we sit differently, right, when we're in the car? How can we drive differently? How about when you're working? What does sitting look like? How can we modify that or do detective work to figure out what about sitting is a problem? Because you can do all the exercises you want, but if you're constantly picking the scab mentally or physically, it's not going to work, right? And so we talked about figuring out how to optimize our healing environment. We talked about doing motions that were safe, not painful, not problematic. So instead of just fully resting, well, hey, I know maybe your back, butt, and your leg is on fire right now, and you're not able to move all that well with your lower body. And I know when you went to PT, they did a bunch of stretches like nerve glides and figure fours and hip openers and all this stuff, and it actually flared you up, made it worse, which it did for her. Uh, but you have an upper body, right? So what if we could find some motions? Or, for example, your left leg is a problem, but what about your right leg? Oh, my right leg can move in good ways. Okay, great. How could we find some motions that are safe, right? Reduce the overall threat such that when people start, they're in a high level of pain, and therefore their functional activity is very low. Maybe you're watching this, you can't do that much. But as we start to reduce their symptoms, their function naturally increases. And notice this line is right in the middle. If this is the end, where people are all better. So like at this 4-week time frame, really strange, right? She was what, like 110, 120, something like that. About, she started at 240 here, high symptoms. Then she went to, 120, 110, something like that. And then eventually she went to 0. So halfway through, about 4 weeks in, we started to say, okay, you're about to make that jump. You're like that mountain goat, right? And there's this big gap, this crevice, this chasm. And you're like wondering, can I start to do more stuff? Or do I have to keep avoiding that stuff? Do I have to keep modifying stuff? Well, hey, you're about halfway there. And so the cool thing is that as you start to gradually expose yourself to things and you start to confront your symptoms in a safe way and challenge your body and your brain, your fear of doing activities, that is actually what allows you to get back to full speed. It's not necessarily resting until your symptoms are completely gone, because the longer you avoid something, the more you reinforce that which you're avoiding is dangerous. You actually teach yourself to live in pain and fear of pain, all right, in reaction to the symptoms. Okay. And so right around this point, we had a conversation. We started to teach her how to, again, start to get back to the gym, start to take longer walks, start to go for longer drives, all these things so that she could actually overcome her fears, and that actually aided in her full recovery. All right. So this is where we're trying to get you. All right. Now, how do we do that? What are some things that we helped her understand? Well, first thing we told her when she said, "Well, how do I know what's too much?" Right? I said, "Well, red light, yellow light, green light. Red light, yellow light, green light. Red light is when you're doing an activity, driving, let's just say, and the symptoms are moderate to high. This all is connected, folks. Moderate to high. All starts with the tracking system as the root of this. Okay, moderate, okay, to high. So in the yellow to the red. So if they're a 60, 70, 80, 90, we'll call that moderate to high. Guess what? It's probably going to flare you up. We probably have to tweak that, modify. We can't quite drive that far. We can't walk that fast. We can't run that far. Whatever it may be, we've got to dial it back. Danger mode. Can't do that. But as you're almost halfway there, your scores are reducing. Chances are you're going to be able to find things that put you in this yellow light category, mild to moderate symptoms. Pain during the activity, it's mild to moderate, but it calms pretty quickly afterwards, somewhere in this medium territory. And the reason that that's really powerful is because it gives you an opportunity to expose yourself to that physically, so that you're not just resting and avoiding stuff and you start to recondition your body. But then mentally, it begins to allow you an opportunity to find safety again, all right? And to restore a sense of safety to your nervous system. Teach your brain that you're okay, all right? So we don't live in avoidance. This is actually a great time to start getting back to things. And obviously, if there's a green light, no pain, no problems, you can fully expose yourself to that thing, okay? So this is the framework that when we got to this point, right, about 50% of the way there, all right, about 50% of the way here at week 4, 5, we had this conversation. Then she continued to use that approach. She didn't have to change any other motions, change anything other than continuing to gradually expose herself in the way that we laid out, using the frameworks that we laid out to the things which are threatening. And before you know it, guess what happens? Not only do her yucky emotions go down, using movement as medicine, but now she's also giving her brain an opportunity to expose herself to things. And before you know it, boom, 0, 80 to 0, 60 to 0, 40 to 0. And she's pain-free technically week 9, week 10. Again, after a year and a half. After trying lots of different things too. But those different things, those different treatments, what were they using to track your progress? Were they being scientific, or were they going based off what you think or you feel? Were they coming in saying, all right, hey, let's get you started on your exercises? Were they taking time to measure anything? before and after, beginning of treatment, during treatment, after treatment, from Monday to Tuesday or Monday to Wednesday between your appointments? Were they tracking things that were meaningful to you? Range of motion and using that little goniometer measurement tool is, yeah, really cool, right? But how does it matter to you? Right? And again, this is why we measure both, because some people have no yuck emotions. Some people that just says, it just says yummy, but they still have trouble here. And this is why you're probably watching, because you have activities and things you want to get back to in life that are meaningful to you. So as much as we care about these motions, and we generally see that if the problem is structural, that as we work together, these go down. Sometimes they start off and they're not a problem at all, and they're completely yummy, but you still can't sit, you still can't drive, you still can't bend, guard, and do things you want. And so this is why we take both these factors into account when it comes to kind of seeing overall what the trend is for saying better or worse. And then we make decisions off of that. All right. So hopefully that makes sense. And again, by doing this, we take you from a place of feeling really yucky and threatened to a place of feeling more safe over time. This is the process. This is week 0 when people work with us, right? Again, at 6 weeks, 100% of people report improvement. All right. So we're tipping everybody to the scale. And then how far on the scale? Well, maybe you still have some to go. Maybe it takes you 9 weeks, 10 weeks, whatever. That's the idea. All right. But we're measuring it. And the cool thing is that when you're in pain, it's a negative feedback loop. You move, it hurts. You do something, it hurts. That sends negative messages to the brain. Danger, danger, don't do that thing. Movement is bad. The less you move, the more you hurt. Less you move, the more you hurt. Negative feedback loop. Pain is an experience of the brain and the body. If somebody's treating you and they're just focused on the body, they're probably missing the boat, because there's also a brain. You also have a head connected to your body, right? But then there's also a body connected to the brain, right? And so we want to look at both of these things. And so it flips this negative feedback loop to a positive feedback loop. One, by we're getting you moving in safe ways, ways that feel good, and immediately improve your experience. How do we know immediately? Because we measure things. And then we're teaching you, hey, movement is good. I don't have to be afraid of movement. I'm okay. The more confident you are moving, the more okay you feel, the more safe you feel. Boom, before you know it, right? You're better. You're better. Not an overnight thing all the time, but definitely a process that works, okay? I've tried lots of different approaches, all right? It works. So cool thing throughout the program and the process too is that we have checkpoints at all different phases, all right, to make sure you're on track. And again, I review these every single week with my client success coach. Her name is Tracy. We review these healing logs that we have access to and you have access to. So any questions, you pull these up, I can pull them up, and we can chat through it based off the data. What did I get? What are any roadblocks you have? And what actions are you taking? Well, what did I get? It's time to get back to life, all right? And I've been doing just that. There is hope for all those who are starting the program. When I first joined, I could not sit, walk, put on a sock, tie my shoe without pain. 8 weeks later, I've traveled and sat through 2 of my daughter's college graduations, traveled to see my son's basketball team win their high school regional championship, take my dog on long walks on their favorite trail. And just yesterday, I tied my left shoe instead of slipping on, celebrating all the small wins, okay? So these are concepts that you can practice even when you feel well, mentally and physically. They will change your life if you apply the concepts and if you are open to learning them, okay? So hopefully that about wraps it up, folks. Okay. We're not relying on guesswork. We're relying on test work. All right. There's a tipping point, crossing the chasm, where it's like, okay, I'm about 50%. As soon as those numbers mathematically, this is a mathematical, systematic process. All right. If you are not following a mathematic, systematic, scientific process, then what are you following? All right. What you think or you feel, or random approaches? Good luck. I don't know how it's going to work. All right. I don't know how you build a house without a tape measure. I don't know how you make things level just by what you think looks level. We've all done that. We've all looked at something, right? Like, I think that looks good, right? And then you put a level on it, you put it, and you're like, oh, wow, I was off. All right. Or, you look at a picture and you're like, that looks weird, right? Looks like it's off. And maybe it's not. It's just your eyes are playing tricks on you. Okay. So we helped you create your own personal pain tracker, right? We talked about the 6 things, the 3 yuck emotions, the 3 pain triggers. All right. We don't want to think that your treatment is working. We want to know it. And we want to know it based off the data and based off the metrics, the math. All right. And then what do? Right? Ask this question. Hey, if things are better week to week, what did we tell her to do? Stay the course. Don't change anything. But Charlie, I want to do something. I know you want to chase the shiny object, but you're getting better. Do you want to be bored, or do you want to be better? Right? Or sorry, do you want to be entertained and do more? Right? Do. You want to be busy, or do you want to be better? Right? I'd rather be bored. Okay, great. Keep going. This doesn't have to be hard. 1 or 2 things for most people. More cooks in the kitchen, right? The harder it becomes to figure out what's happening, what's going on. Okay. If you're same, you got to change something. You can't expect something that's not working to just someday work. if you flick this light switch on right now, right, and the light doesn't turn on, you can keep flicking the light switch. The light isn't going to come on. Keep doing it as much as you want. It's not going to work. And if something's making you worse, it's not this no pain, no gain. Oh, maybe it's got to get worse before it gets better. Right? I don't know where. Maybe I got to get heavier before I lose weight. Right? Maybe I got to get heavier before I get skinnier. I don't know. I don't know. I don't think that makes a lot of sense. And I think probably most of you watching would agree. All right. So again, look, this is all I do. I'm in the trenches working with people like you. All right. So hopefully that workshop was eye-opening for you, was informative in that it helped you see a different way to go about being very systematic and scientific regarding your pain relief. And rather than guessing, we can actually start testing, and we can start to measure and track exactly what's happening within our body, right, and within our pain experience, so that we can continue to make decisions based off the data rather than the emotion of what we think or feel. Let me know your thoughts in the comments. Was this helpful? Was it not? And then, as always, if you're interested in learning how to resolve your problem naturally and you'd like some help, I would be happy to review your case personally. Just click the link to apply to work with us. We work with people all around the world dealing with these issues. Click the link to apply, set up a time to chat, and then follow instructions to submit a detailed case review. Thanks so much. Chat soon.